This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association, Watch Wisconsin Eye on Spectrum Channels 995 and 363, and at wisi.org.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, please stay on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's briefing are Governor Tony Evers and DHS Secretary-designee Andrea, and also available to answer questions are Stephanie Smiley, the Interim Administrator of the DHS Division of Public Health and Interim State Health Officer, and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thank you for joining us again today. As you know, last week we announced that at the request of healthcare systems that we are operationalizing the Alternate Care Facility, or ACF, at State Fair Park, which will begin accepting patients tomorrow to help alleviate some of the strain on our healthcare systems. But here's the bottom line, folks. We have got to this point. We have to get this virus under control and help flatten the curve to prevent our healthcare systems from being overwhelmed. As I said last week, over the last month, our hospitalizations have nearly tripled. We hoped we would never have to open the ACF, but now that we have, the best case scenario is that we never have to use it, because that will mean our statewide efforts to stop the spread and flatten the curve will have been successful. As a reminder, the ACF at State Fair Park is not a hospital and will not accept walk-in patients, and patients will only be admitted in coordination with healthcare providers. As of this weekend, we hit yet another grim milestone as positive COVID-19 cases reached 150,000 in Wisconsin. We continue to have record-setting days, and the pandemic continues to affect our lives, slow down our economy, and prevent our communities and state from bouncing back. That's why last week we announced additional care investments for Wisconsin businesses, families, and workers, including an additional $50 million for the We're All In small business grants, $10 million for the Wisconsin Rental Assistance Program, and $16 million to help folks with utility costs as we head into the winter months. And today we announced $50 million in funding for an additional round of child care counts payments for early care and education. For many working families, having access to safe, affordable child care is a necessity, and these critical investments continue to help stabilize the early care and education system and provide critical support to providers and families. There isn't a family, worker, business, or community that hasn't been affected by the pandemic. And these investments will provide the needed help, but only for the time being. In order to kick this virus and get Wisconsin back on track, it's going to take a unified statewide effort. And I think for the most part, Wisconsinites know that. You know that we have to work together to get through this, and I want to recognize every Wisconsinite who has stepped up by staying home, wearing a mask, and keeping your distance, and to share my thanks for all of you have been doing to keep your neighbors safe and to stay healthy. Your efforts can and will save lives, but it's not enough. It's not enough that Wisconsinites have had to put plans on hold, cancel weddings, vacations, celebrations, change their businesses, alter how they live and work, and sacrifice so much over the past 8 months. Because when I say we need a united statewide effort, I mean everyone, including elected officials. It has been more than 180 days since the legislature last met. Instead, they have spent their time in the courts trying to thwart every state effort to keep Wisconsinites healthy and safe. And time again, we've heard that Republican legislators just want a seat at the table. I've been sitting here at this table, which is the same place I've sat about once a week for months now, and I have yet to hear any ideas, plans, or solutions. Last week, we learned the Republicans in the legislature plan to come in and vote down our statewide COVID-19 public health emergency and our order requiring face coverings in public places. Not only that, but that they intend to wait to take that vote until after Election Day. Folks, that's just not right. First and foremost, in light of the near exponential increase in cases, rising hospitalization rates, and the beginning of cold and flu season, ending our public health emergency in the midst of a global pandemic would have serious consequences for our state. But regardless, Wisconsinites deserve to know where their elected leaders stand on these critically important issues. I've sent legislators a letter asking them just that, sharing my concerns about their plan, and once again inviting Republican leaders to meet. I'm hopeful that they will put their ideas and feedback and plans to paper so that we can urgently address the challenges facing our state. Because here's the bottom line for me: Wisconsin families and frontline healthcare workers, businesses, farmers, hospital systems, and folks across our state deserve to know sooner rather than later whether our state will once again be thrown into chaos as a result of yet another Republican effort to prevent us from keeping people safe. So today, I'm encouraging every Wisconsinite to contact their state senators and state representatives and ask them whether they support our state's public health emergency, whether they support requiring face coverings in public places like 72% of Wisconsinites, and whether they believe the legislature should come in for a vote in advance of the November election. You can find your legislators' contact information by typing in your address at lagis.wisconsin.gov. So with that, I will now turn things over to Secretary-designee Andrea for her updates on the COVID-19 in Wisconsin. Andrea?
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again today. I do want to start with the numbers today because I want to make sure that we're all tracking on the magnitude of the challenge that we're facing here in Wisconsin. There are now 155,471 confirmed cases of COVID-19, which is an increase of 3,279 from yesterday. Our 7-day average of new daily cases is 2,727, which is up from 1,141 1 month ago. We saw a record number of deaths today, with 34 more Wisconsinites losing their lives. Our total deaths have now reached 1,508. Our hearts go out to the families who have lost loved ones to COVID-19. Tomorrow, the alternate care facility at the Wisconsin State Fair Park will open. It's ready to accept COVID-19 transfer patients from Wisconsin hospitals. The facility is prepared to accept up to 50 patients on its first day, and we will scale that capacity as needed. A multidisciplinary clinical team is ready to serve patients, including doctors, nurses, social workers, pharmacists, and other medical staff. Our current surge in cases will lead to more hospitalizations, which is why we must be prepared. As the governor said, we hope we do not need this overflow capacity, but the reality of this virus, its transmissibility, its incubation time, and its potential severity dictates that we get ready. So as we work at the state level with our healthcare and public health partners to provide testing, tracing, and treatment, we need everyone in Wisconsin to work at the individual, family, and community level to help stop the spread. Stay home as much as you can. If you can work from home, please do. Limit your errands to the essentials as much as you can. Yes, get your groceries and go to the pharmacy, but please cancel the dinner parties and the happy hours. Wear a mask because your mask protects me and my mask protects you. Remember to stay 6 feet apart from other people. Masks are an effective tool, but they are most effective when we all do it and when we combine it with other actions, like practicing physical distancing and washing our hands frequently. If you have symptoms or have been exposed to COVID-19, please get tested. Call your healthcare provider or visit one of our community testing sites. Then be sure to quarantine. Self-isolate if you get a positive result, and while you await the call from a contact tracer, reach out to your close contacts and ask them to do the same. And please, get a flu shot. It's more important this year than ever. The flu shot can't prevent a COVID-19 infection, but by preventing a flu infection, it can help you stay healthy and preserve our hospital capacity. These are steps we can all take to stop the spread and protect ourselves and each other. Thank you.
Thank you. And we'll now take your questions. A reminder to maintain audio quality, to please keep phones on mute until it is time to ask your question. And we'll begin this afternoon with Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yes, thanks for taking my question. My question today is for Governor Evers. Governor, 2 more Green Bay area businesses closed down permanently over the weekend, citing the COVID-19 emergency and the emergency orders that you have put down. What do you say to business people who are hurting in spite of state assistance? And specifically, what do you say to their employees who are being thrown into an unemployment system that is months behind? Thank you very much.
Well, I'll start with the last part first. Our Department of Workforce Development is doing a yeoman's work as far as trying to catch up, and we feel we're going to be in a pretty good place in the very near future. So make sure the people that are thrown out of work are applying for benefits, and we'll do our best to get them out as soon as possible. But at the end of the day, we need federal help around this. We need federal help for small businesses. We have put hundreds of millions of dollars into the system as it relates to supporting small businesses. But as you know, in the beginning of the pandemic, the Congress was actively involved with several large programs that help those businesses. We need that federal money. I encourage people at the local level to reach out to their their representatives in Congress to do whatever they can to get a deal going. Again, it's politics as usual in Washington, D.C. also. But at the end of the day, we do need, and our small businesses need, some more federal resources to stay alive and to remain in a position to continue to serve the people of Wisconsin.
Thank you, Rob. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this. I was wondering, for the surge facility that opens tomorrow, have any health systems said that they're planning to transfer patients to it on the first day? What do you expect to be the use on the first day? Thanks.
Yeah, Sean, we are in very constant communication with hospitals who may be ready to transfer patients as early as tomorrow. Obviously, all of this is very dynamic, and our hospital partners in those systems are working within their surge plans and their surge capacity to flex and to accommodate patients within their systems or among other hospitals locally. And as they really actively manage that patient load today, see who additionally needs to be admitted, who is ready for discharge, that information will become more clear as those things happen throughout the day. And we will continue to talk with them throughout the day, into the evening, and tomorrow morning, in anticipation of getting some greater clarity about who may need us to take patients on the first day and when they might arrive after we open at 8 a.m.
Thank you, Sean. Now to Jason Zimmerman from WBAY TV in Green Bay. Jason. Jason Zimmerman from WBAY. Remember *6 to unmute your phone. Once more for Jason Zimmerman. Okay, we'll have to move on then to Jeff Dada from Spectrum News, Wisconsin. Jeff?
Hi, thank you for taking my question. We've heard some anecdotal reports of people waiting up to a week for test results in parts of Wisconsin. I know for state results, it takes about 1 or 3 days, DHS says, but what's your level of concern for some of the other parts of the state with more private or localized testing systems that might be taking longer? And do you feel like our testing capacity can hold up amid this surge in cases?
I mean, I think that our testing turnaround times are an important part of making sure that we have actionable information as soon as possible. I have not been hearing that our turnaround times are exceeding the 3 to 5 day time frame that we have been tracking pretty consistently, and I have not heard that labs outside of the state of Wisconsin are back to a place where their turnaround times are where they were before. In July and August, they were exceeding 7, 10, 12 kind of day time frames. I have not heard that either. So we continue to be focused on that. We continue to expand our testing capacity in anticipation of increased demand for testing. We currently are tracking at 117 labs across the state of Wisconsin that are able to process and are actively processing COVID tests for a daily capacity of just over 42,000 tests. So we encourage folks, anybody who has symptoms or has been a close contact of a positive case, to please access a test. And we continue to want to use that information in a timely way to action public health, the next public health steps to help stop the spread.
Thank you, Jeff. Now to Danny Maxwell from WKOW TV in Madison. Danny?
Hi, this message is for the governor. Governor, just wanted to get your opinion on whether election officials should be allowed to count absentee ballots ahead of Election Day, as a group of Democrats are calling on Republican leaders to host this extraordinary session to do just that.
Yeah, that's a great question. Actually, before we had our Safer at Home, or before the last primary, or the primary in April, we proposed legislation that would do that. In addition to counting early, I mean, I just think it's insulting to the clerks that they can't do it early because of some fear that they're going to be spilling the beans ahead of time. That's a ridiculous idea. So counting early is important. We put that in, and also allowing them to be counted after they have it postmarked by the election date, and then allowing them to be counted after that. We had that we talked about it before the election last April, and we also included it in our first COVID-19 legislative package, and the Republicans weren't interested in that. So we are stuck where we're at. I wish we could get people back to change that so that the counting could happen in a better way.
Thank you, Danny. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly.
Hi, I was wondering if you could tell us more about what kind of patients will be at the field hospital. Will COVID patients be at this hospital, or will they be people with less serious illnesses?
Thanks, Molly. So this facility will treat COVID positive patients only. We will not transfer from other hospitals patients who are not COVID positive, and they will need to be of a lower acuity. The goal is to take pressure off local hospitals to treat the more severely ill COVID patients as well as their non-COVID patient load. And so we will take, again, lower acuity COVID patients who need a lower level of care and who are closer to being ready to discharge and return home as they recover from their illness.
Thank you, Molly. Now to Rachel Glass from TMJ4 in Milwaukee. Rachel? Rachel from TMJ4. And we'll move on then to Stephanie Hoff from West Politics. Stephanie?
Hello?
How's this?
This is Rachel.
Hello,
Okay.
thanks.
Oh.
Let's
Rachel can wait.
Stephanie go first, please. Stephanie Hoff from West Politics.
Hi, yeah. Thanks for taking my call. My question is for the governor. So JCRAR voted to require you to submit your emergency capacity limit order as a rule. Your 30-day clock started yesterday. Are you going to submit the order as a rule or wait and find a way around that?
We don't have an order. There is no reason to have an order because, a rule. We don't have a rule prepared. There's no reason to have a rule prepared because we have an emergency order that is in place in the state of Wisconsin.
I think it's also worth pointing out on that JCRAR meeting yesterday, it was a pointless exercise. Under statute, when JCRAR orders an agency to promulgate a rule, they can only do so under limited circumstances, which, as the governor said, just don't apply here. And secondly, when JCRAR does order so, there's a 30-day deadline to do so, and Emergency Order 3 expires days beforehand. So there's absolutely, even if they were right on the law, there's no consequence for this. And it was instead of actually taking concrete action to do something with the pandemic, instead it was a pointless exercise in order to make a political point. Nothing more and nothing less.
Thank you, Stephanie. Now we'll try to go back to Rachel Glass from TMJ4 in Milwaukee. Rachel?
Sorry about that. Thank you. Secretary Palm, could you reiterate how many patients the State Fair Park facility will be able to handle tomorrow? You had mentioned it, but I missed it. And then is there a number of patients that you're kind of expecting in the first week? Mm-hmm. Thank you.
Sure. So we are prepared and staffed for up to 50 patients tomorrow, and we'll be able to scale from there depending on need and our ongoing conversations with hospitals about how their capacity is and what they need from us in terms of backup in that surge in the alternate care facility. As I mentioned, we have been in very close contact with the hospitals since they asked us to stand up and turn the facility back on and get it ready to operate about when and how many patients they may need in the early days. They are very actively managing their patient loads, using their surge capacity, the flexibilities that they have, relying on each other to share patients, to transfer patients, to make sure that they are managing their capacity that allows them to best treat those folks. And so as they, throughout the day, look at admissions and discharges and their capacity overall and their staffing issues, their staffing levels, it will become much more clear into the evening and overnight if and how many patients we will need to be ready to take tomorrow. But we are ready to take up to 50, and we'll be able to provide transport for those patients should any of our hospitals need us to take transfers tomorrow.
Thank you, Rachel. Now to Scott Bauer from the Associated Press. Scott? Scott Bauer.
Hi, sorry about that. Thanks for doing the call. Governor, have you been told by law enforcement if you were a target for kidnapping like Governor Whitmer was by those militia members out of Michigan?
No, I have not had any indication from our security that is the case. They handle all those issues, Scott, and so no, I haven't heard a thing.
Thanks, Scott. Now to Isabel Lawrence from NBC 15 in Madison. Isabel?
Hi. Yes, thank you. In terms of the care facility again at State Fair Park, in the weeks and months to come, if worst case scenario, the park were to exceed capacity, is there a backup to that option?
I think what you were asking was about the capacity of the alternate care facility, and should we see cases that exceed that capacity, what the plan is. I think that's what you asked. The alternate care facility at State Fair Park has the capacity for 530 patients, and we did work with the Army Corps looking at sites around the state when we identified the State Fair Park site, and we do have plans, drawings for a facility here in Dane County. We did not activate construction or take it further than the plan design phase, but that would be an option, and we continue to talk with other parts of the state about these issues of surge and capacity, and what we should consider in that regard. But we are certainly hopeful, and this speaks to the need for all of us to act together to reflatten the curve. We as a state, we as a people control what happens next in this pandemic, and we control how many beds in that alternate care facility we may need to use by wearing a mask and staying home as much as possible, avoiding social gatherings that are with folks outside of our household, practicing really vigilant social distancing, and the things that we have been talking about since the spring. So much of this is in our hands, and now really is the time to act, to double down, to do what we need to do so we don't exceed the capacity either of our hospitals or of our backup plan via the alternate care facility.
Thank you, Isabel. Now to Mason Dowling from WAOW-TV in Wausau. Mason.
Hi, thanks for taking this call. This question is for DHS, but really whoever feels like answering it. There are, it seems like every week, schools deciding either to go back to in-person or shifting to online classes because of COVID cases. I wanted to see if there was any recommendation from DHS now that cases continue to spike and climb towards schools statewide in regards to holding classes in person.
Yeah, and I'll jump in here, and if Andrea has anything to add, she can do that. Our schools are monitoring this, obviously, every single day. There are people that are going to remote and then coming back from that. And the CDC actually has guidance that most of the public health officials across the state are using when they're consulting with school districts. That CDC guidance is not definitive. It doesn't tell people if X happens, this is what Y happens. It just talks about the important things that people should look at. And I know that it's widely used across the state as a way to kind of take the temperature and what's going on in the schools. And school districts are doing their best to keep all kids safe and make sure that they are able to provide the education they need, whether they're remote or in person.
Thank you, Mason. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell? Again, Mitchell Schmidt from the Wisconsin State Journal. We're going to move on then to Rose Schmidt from CBS 58 in Milwaukee. Rose? Rose Schmidt from CBS 58. Okay, moving on again, then to Denise Lockwood from Racine.
Yeah. I'm sorry, this is Mitch with the State Journal.
Hi, Mitchell. Go ahead, please.
I'm sorry about that, phone issues. Real quick, just jumping back to the governor's kind of opening remarks regarding hope to kind of come to some sort of a bipartisan agreement on this. Obviously, you know, there's been some headbutting between between the governor's office and Republicans, and it's been challenging to kind of reach something like that. I'm just curious if you might be able to talk a little bit about, you know, how you kind of rate your confidence that this time we might reach kind of a mutual agreement. And then just piggybacking on that, have you heard anything back from Republican leaders following your letter yesterday? Thank you.
The answer to the second question is I believe not that I've heard anything recently. But here's what the sad part of it, what gives me some hope, Mitchell, is that people see numbers like 34 people have passed away in today's report. I mean, how many more do we need before people can take action? So I'm hoping that the severity of what's going on in the state of Wisconsin now will bring people to the table. We know what the Republicans are against. They've been against orders around masks. They've been against orders about any kind of mitigation of public gatherings in the state, all things that, frankly, are part of any public health notion of what will contain this virus. And so I'm hopeful that they have some ideas. When the Supreme Court twisted themselves into pretzels in order to do away with the safer at home way last spring, the Republicans in one of their arguments was saying they have a plan. It's time.
Thank you, Mitchell. Now to Denise Lockwood from Racine County I. Denise?
Hi, this is Rose Schmidt from CBS 58. You called on me earlier. I was having some phone issues. Can you hear me now?
All right, one at a time, please. We'll start then with Rose Schmidt. Go ahead, please.
Hi. My question is for Governor Evers. President Trump has a visit scheduled for Janesville this weekend. Some Democrats have expressed concerns about crowd sizes from visits of the Trump family this week. I guess my question would be, have you had any communication with President Trump's campaign about his upcoming rally? And, you know, what's your recommendation for future campaign rallies going forward from, you know, any candidate, I guess?
Yeah, and I think the last question is important. No, I haven't had any conversation. I guess I didn't know until this moment that he's coming back to Janesville. But I saw what happened in Florida, wherever he was yesterday, and basically a large crowd of supporters. The vast majority were without masks. The vast majority were not physically distant. And I understand that political events are when we look at what we have dealt with in the public gathering order that we have in place right now, it's for indoor things. This is likely outdoors, but the fact of the matter is, it's just bad. It's just bad thinking that we can have large gatherings even outside when no one is socially distanced and no one is wearing a mask. They claim that they take, and I'll take them at their word, that they're taking temperatures of people when they come in, and they're handing them a mask. Well, having a normal temperature doesn't mean that you don't have COVID-19, and handing out a mask doesn't mean you're going to wear the damn thing. So the president has the ultimate authority around this issue when he has events. I mean, there's a certain number of people that come, and he can tell them you have to wear a mask and be socially distant, or you can't stay. It's a pretty simple story. Now, yesterday he talked about the fact that he was so excited about being immune, which he's not, and that he's so excited to be with his supporters, which I understand. And he was going to do whatever. He was so excited he wanted to kiss everybody. Well, I know he was saying that in jest, but good Lord, let's use common sense. Let's make people wear a mask. Let's make sure they're physically distant. We just had today a report where 34 deaths are happened in the state recently, and our numbers continue to be exorbitant and high and deadly, and we need to focus on what we can do as a state to survive this pandemic in a way that doesn't kill more people, and having people not wear masks and not socially distance is not the way we're going to solve this. We need the president's help here.
Thank you, Rose. Now to Denise Lockwood from Racine County I. Denise.
Hi. My question is around unemployment and who's receiving it and when. So I've got several sources that are telling me that people who are working are getting a turnaround time of a couple of days with unemployment benefits versus people who are unemployed having lengths of turnaround time for 7 months. Can you kind of highlight a little bit more about why that's happening?
Well, sure, and this is an ongoing issue. Clearly, our system that is in place to take care of unemployment insurance is inadequate and old and should have been replaced or updated several years ago, and it wasn't. I'm not casting blame, but that's just the fact of it. And every time that the federal government makes a change in it, which is often, it takes weeks to get the program in place. For example, the president on an executive orders, I think the beginning of September, someplace in there around Labor Day, authorized $300 additional for certain people. The programming for that was just finished a few weeks ago, and we are now in the process of processing those claims. So yes, we have a change of leadership, and I feel very strongly about that change, and it's paying off, and that they're really working hard to change the system as they go along and get those numbers down so it doesn't take 7 months anymore. I believe by the end of the calendar year we will be in a good place. And we're in a much better place now than we were several weeks ago.
Denise, thank you. Now to Katrina Nickel from WLUK TV in Green Bay. Katrina?
Hi there, thanks for taking this call. So my question is more about these alternative care facilities and field hospital opening up tomorrow. Are there hospitals or regions that will take priority in being able to send patients? I know we talked a little bit about what patients will be sent there, but what about specifically for hospitals and regions where outbreaks are higher than others?
Mm-hmm. That is a great question. We will have capacity for 50 patients when we open tomorrow. We do not anticipate that there that regions would need to compete or hospitals would need to compete for those slots, and we will scale our capacity up to meet the need. Obviously, the parts of our state, the Fox Valley, the north, east and north central parts of the state are the places where we are hearing most acute capacity issues from our hospital partners, but we are tracking and in close conversations with other hospitals around the state so that we are able to understand and anticipate as this evolves what those hospitals are seeing, what they're experiencing, how their surge capacity and planning and work in that space is going for them, how full they are, what their staffing issues are, and those are important touch points for us to be able to anticipate the need and demand for the alternate care facility. But again, we can surge all the way to 530 patients at the alternate care facility, and we will be tracking against the needs of our hospitals so that we can accommodate them as we're needed.
Thank you, Katrina. Now to Will Cushman from West Context. Will?
Good afternoon. My question is for Secretary-designee Palm. I am curious about the wastewater surveillance study that was started over the summer, I believe in June. and is being conducted by the State Hygiene Lab. I'm wondering if the Department of Health Services has taken receipt of any data from that study and whether that has informed any of your mitigation strategies. I believe back in the summer, it was hoped that the testing could help potentially provide like an early warning detection system of local outbreaks. And I'm just curious if that is occurring as hoped. Thank you.
Yeah, you have a good memory about what we were hoping those studies would tell us. I wish Dr. Westergaard was here today. Today is his birthday, and he took the day off. He would be able to give you all sorts of details about what we're hearing and seeing in those studies. Will, if it's okay, I'd like to have somebody be able to get back to you on details. I think in the broader context, I have not seen data, information coming out of those studies that have informed mitigation strategies so far. But again, Dr. Westergaard would know what we are hearing and seeing from those the investments we made in the wastewater study earlier this summer.
Thank you, Will. Now to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Yes, this is sort of a broad question. What would you attribute why things have gotten so bad now, the timing of it? What's different now than it was in Wisconsin in June, July, or August?
Well, I'll start from the 30,000 foot level, and it just is clear that what's different now than before is that we've let down our guard. The dissolution of the Safer at Home and the order in May and the following chaotic situation that exists because of a really interesting but odd decision-making process where essentially the state was changed from some thoughtful mitigation practices and moving away from those mitigation practices in a thoughtful way to boom, it's over. And eventually that caught up to us, and frankly, there's pandemic. People are tired of the pandemic, and they're tired of wearing masks, and I think there's been some letdown over the summer, and that has created a situation where, right now, 30%, and most recent polling talks about 30% of the people are not supportive of a mask ban of any kind, and that's a bunch of people. And we have got to turn this around. We've got to take that individual responsibility. But I just think it's a combination of the court's ruling along with the issue of making sure that we want to stay the course and not lose focus.
Stephanie, do you want to say anything about the sort of epidemiology and the way the virus and this concept of exponential growth?
Yeah, happy to. I would say that, based on exactly what the governor was talking about in terms of the sort of what we had anticipated earlier in the spring was sort of what we're seeing now, which is why we had the Safer at Home, order in place previously. We didn't want to overrun our healthcare system or our public health system. And so, it really is incumbent upon us because we are seeing, the growth in cases, reporting thousands of cases each day. As of late, and that is going to result in more hospitalizations, and it will result in more deaths, which is completely, it can be preventable. And so what we're really encouraging people right now is that we've got sort of an all hands on deck approach. We have got to really join together, to beat this virus. And the sooner we do that, the sooner we're going to be able to, engage in the activities that, that we so are longing to do. And, really trying to we're watching, this case growth in the curve of our, the epi curve continuing to creep up and to spike really in certain age groups, as well as, overall now. And we have to join together to stop the spread.
Thank you, Jonathan. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline.
Hello, my question is for the governor. There is now a third COVID-19 outbreak inside Wisconsin's prisons. This time it's Racine Correctional. At last check, there were over 120 active cases. Similarly, Kettle Moraine has over 400 active cases. Governor, what's just your take on this situation? And then also, some advocacy groups are calling on you to release certain inmates as social distancing becomes more and more difficult. Is this something you would be willing to consider? Thank you.
Yeah, and I just have just a few comments. Certainly, those numbers are absolutely troubling, and I know the Department of Corrections has done a great job of when people are found to be COVID-19 positive, they get them separate from the general population, making sure that they're there for as long as it takes for them to be negatively are shown to be negative on the COVID test so that they can re-enter the system. But the numbers are large, and it's concerning. It obviously also is reflective of the fact that this pandemic is community spread, and the people that are in our care in these institutions, they aren't going back out and in the general population and hanging out together. They're there, so we have to make sure that the people that work there, the people that are interacting with inmates are not bringing that into the prison. So we're working on that as we speak. The numbers are very, very concerning. We have to make sure that the people that are in our care are taken care of.
Thank you, Madeline. Now to Terry Sater from WISN TV in Milwaukee. Terry?
Good afternoon. My question is for the governor. Good afternoon, Governor. Thank you for doing this. This morning, Speaker Voss told me that he has made millions of dollars in funds available to you to request in response to the pandemic, and that you have not requested any of that money. You say that the Republicans have not reached out to you. Where does the divide between you and the Republican legislature put Wisconsinites in responding to the pandemic?
Well, they should be thoroughly confused. The bottom line is, in order for us to move forward as a state, we have to contain the virus, and any mitigation strategies that is related to doing that, they've opposed. And so, whatever that $11 million is, it's important, but it's not as important as getting the virus under control. All the CARES money that we have given to different organizations and the farmers and the small businesses and so on across the state, it's important as a response to what's happening with the virus. But if we don't find a way to restrain that virus that we've all agreed to, with the mitigation strategies that work, we can just keep adding money to that pot and continue spending it because we're not doing the simple stuff that frankly doesn't cost a hell of a lot. The testing does, I understand that. Contact tracing does. Masks are pretty darn cheap. And so, and doing things that get to the issue of individual responsibility, that's pretty cheap too. So we need to come together on the important thing, and that is beating down this virus and using the mitigation strategies that are well known to everybody.
Thank you, Terry. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking my question.
there are parts of the state where the mask requirement is being widely disregarded, and even with the capacity restriction order, that seems to be disregarded as well. Sort of anecdotal reports by people who may travel around the state and see these things. Is it possible, / would it have been possible to enforce either of those more rigorously? And are there pros and cons to taking a more aggressive form of enforcement on these? Thank you.
Well, actually, I was at a conversation with Midwest governors just yesterday about this issue and talking about ways that are of some consequence that encourage people to do the right thing. And frankly, there's not many. Most of our neighboring states are having some of the same problems we're having. But I would say that's difficult. I mean, our police force is not large in the state of Wisconsin. The idea that they're going to be rounding up people and doing something to convince them to wear a mask, whether it's fining, whether it's huge fines or whatever that could be. It's at the end of the day, it's about individual responsibility. I've said this a million times. I'm so sick of saying it, but we have all sorts of regulations that people do observe. Deer hunting season is a limited season. People just don't go out there. I know there are some, but people just don't go out there because they understand that if they break those rules, that the herd size will be impacted, very negatively. People pretty much, for the most part, don't drive on the wrong way of the road. They understand that that's not a safe thing to do, and it could hurt themselves and others. There's all sorts of restrictions in our state that, frankly, aren't necessarily policed on a 24/7 issue. People just respect it and do it. That's what we need. That's what we need to do in our state. As I said, I talked to governors from the other states in the Midwest recently or yesterday. They're having the same problems we are. I will say, though, incidentally, that I do connect with people all around the state on this issue on a regular basis, just regular folks, not police officers, and they have told me, and maybe it's just because they're talking to me or interacting with me, but the mask order has made a difference. They've seen more people wearing them. They've seen more observance of it in retail stores across the state. So, I know you have your data. I have my informal data, but I do think it's making a difference.
Thank you, Eric. Now to Christina Leifring from Up North News. Christina?
Hi. As a follow-up to your conversation with other Midwestern governors, do you know of any other states that have had to create a alternative location for hospital overflow, such as what we have at the state fairgrounds?
We didn't talk about it yesterday, and we do talk often, but I can't ever remember talking about it with any other Midwest state that has created an alternate facility. So I do believe, I'm pretty confident that my answer would be that they haven't.
Thank you, Christina. Now to LaToya Dennis from Milwaukee Public Radio. LaToya? LaToya Dennis? Okay, moving on then to Tyler Job from WKBT TV in La Crosse. Tyler?
Yes, thank you so much for taking my call. This is my question for the DHS, or anyone else can jump in. But La Crosse County right now is seeing an outbreak in several long-term care facilities. The DHS website says there are 12 active public health investigations at long-term care facilities. So my question is, what exactly prompts a public health investigation? And are you worried there will be more public health investigations at long-term care facilities, not only in La Crosse County, but the entire state?
I'll let Stephanie plug in some details here, but an outbreak investigation in a long-term care facility requires that there is a single positive case. What we know about long-term care is that they are a population who is particularly vulnerable to severe illness, and so we want to make sure that we are doing everything we can as a state in partnership with our long-term care facilities to protect those folks, to bring assets and resources to the table to help stop the spread in those facilities, considering the vulnerability of the people who live there. And that is in contrast to other outbreaks in triggering an investigation in facilities that are not long-term care facilities. It requires 2 or more positive cases. But again, we're really wanting to focus and make sure we are doing everything we can in the long-term care space to protect those particularly vulnerable populations. But Stephanie, I'd welcome additional comments or details.
Yeah, absolutely. So you're spot on, Secretary. It just in terms of the how we define or how when we launch an investigation, and because of the vulnerable populations in long-term care facilities, it is a single confirmed case, either among a patient or a resident or a staff person, that would trigger somebody, local public health and or state public health to be asking and conduct what we call a communicable disease investigation. So it's really trying to figure out where to the best of our ability, is there transmission occurring in that particular facility, and if not, great, but we also want to make sure that the individuals who have tested positive are then isolated, so that there is not spread that is happening in that facility. So you may end up conducting an investigation that doesn't actually turn into an outbreak situation, which is obviously the hope, which is why we want to know about a single case in a long-term care facility and 2 cases in other types of group settings. Once we learn about those situations, then we can provide the technical assistance, as needed to be able to ensure that the spread is minimized in those facilities. And then also, really wanting to make sure that individuals understand what their next steps are if they did not, if there is not spread happening in that facility, that they are ensuring that they're not coming to work and that they are safely isolating in their homes is also something that we want to make sure happens. I think we can anticipate, that the more, higher the case numbers that we're seeing in our state, we are at very high, sort of case numbers. We will anticipate seeing more investigations and more outbreaks, unfortunately, in these facilities. That's certainly not the goal. But we know in order to get a handle on this, we've got to, it has to be an all hands on deck approach, and hopefully, folks really do heed the advice that we're putting out here today and always.
Thank you, Tyler. Now to Stephen Joyce from Bloomberg. Stephen? Again, Stephen Joyce. Okay, and our final question today belongs to News 3 Now in Madison. WISC TV in Madison. Okay, moving on, then we'll go back to some who weren't available when we called on them before. Latoya Dennis from Milwaukee Public Radio. Latoya? Jason Zimmerman from WBAY TV in Green Bay. Jason. Okay, well, with that concludes today's briefing.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.